This is a presentation on hearing and speech disorders for the iReach program. First, a quick acknowledgement that this project is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services, and that the contents are those of the authors and don't necessarily represent the official views of, nor an endorsement by HRSA, HHS, or the U.S. government. For this presentation on hearing and speech disorders, there are 3 learning objectives. So by the end of this presentation, hopefully you'll be able to 1. Identify signs and symptoms of hearing, speech, and swallowing disorders in adults. 2. Understand referral for appropriate assessment of hearing, speech, and swallowing disorders. And 3rd, treatment options for hearing, speech, and swallowing disorders. First, let's review signs and symptoms of hearing disorders. Hearing disorders are sometimes referred to as being hard of hearing, and they're a result of damage to the outer, middle, or inner ear. Currently, more than 1.3 million veterans receive disability compensation for hearing loss, and more than 2.3 million receive compensation for tinnitus, or ringing in the ears. Veterans in rural areas may be twice as likely to experience these hearing disorders. Some signs and symptoms that we see associated with hearing disorders include avoiding social settings or reduced participation in activities, constant requests for repetition, difficulty understanding speech, increasing the volume of television or other devices, a complaint of ringing in the ears either constantly or intermittently, listening fatigue or feeling like someone has to put a lot of effort into hearing others, and then speaking too softly or too loudly. Now let's review signs and symptoms of speech and language disorders. Speech is how we say sounds and words. Language is the words we use to share ideas and achieve goals. Speech and language disorders are common after traumatic brain injury, or TBI, stroke, and head and neck cancer. All of these diagnoses are more common in persons that live in rural areas, and we see that veterans with TBI are at an increased long-term risk for stroke. Some signs and symptoms of speech and language disorders include difficulty saying sounds and words clearly, having a hoarse or raspy voice, problems understanding, talking, reading, or writing, difficulty organizing thoughts and planning ahead, poor problem solving, or not understanding facial expressions or nonverbal communication. Now we'll review signs and symptoms of swallowing disorders. Dysphagia is a swallowing problem involving the mouth, throat, esophagus, or stomach. Dysphagia can lead to malnutrition and dehydration, aspiration pneumonia, chronic lung disease, choking, and even death. It's estimated to occur in 1 out of 25 adults each year. Veterans experience medical conditions that are known to result in dysphagia, including head and neck cancer, progressive neurologic disease such as myasthenia gravis or multiple sclerosis, stroke, and respiratory distress, at a higher rate than non-veterans. Signs and symptoms of swallowing disorders or dysphagia may be poor oral management of secretions, extra time needed to chew, difficulty coordinating breathing and swallowing, coughing or throat clearing during or after eating or drinking, weight loss, malnutrition or dehydration, or recurring pneumonia or fever. It's important to know who to refer to for hearing, speech, and swallowing problems so that appropriate intervention can be developed. Audiologists who hold the American Speech-Language Hearing Association, or ASHA, Certificate of Clinical Competence, are certified to evaluate and treat a variety of hearing disorders. Speech-language pathologists who hold ASHA's Cs are certified to evaluate and treat speech and swallowing disorders. You can locate a certified provider near you by using ASHA's ProFind tool at asha.org/ProFind. A variety of treatment options exist for hearing, speech, language, and swallowing disorders. Hearing treatment may involve hearing aids or cochlear implants, counseling and education, or hearing assistive technology systems such as telephone amplifiers or alerting devices. Speech and language intervention may include restorative and compensatory therapy, augmentative and alternative communication devices, or speaking valves and voice prostheses. Swallowing intervention can include exercises and maneuvers for swallowing safety, posture and positioning, or diet texture modification. Thank you very much for listening to this presentation. Please feel free to check out all the other video presentations and modules of the iReach program. You'll also find accompanying fact sheets that include additional resources. Thank you for your time.